Welcome back to the Island Docs. We have just been discussing the Ebola virus, which is one of the most deadly viruses with a mortality rate about 89%, and the fact that it causes a hemorrhagic fever. But now we're going to talk about dengue fever. When I was an emergency room doctor in Trinidad, this is something that you see so often, so many cases of dengue coming in because it's spread by the mosquito.
Right. And dengue also causes a hemorrhagic fever similarly to the Ebola. So this is when the Ebola virus was spread by contact with fluid, but this one is spread by mosquito. So if a mosquito bites you that has the dengue virus, there's a possibility of, you contracting the virus. Now, dengue presents with different signs and symptoms. So some of the things that people will look for is chills,
Fever.
headache, generally feeling unwell, vomiting, diarrhea, rash. It's a very,
It just
very...
feels like you just had a bad flu and you just can't get over it.
Yes, but what is really, really important about having dengue is when you have a really, really high fever. And the thing about the fever is not a fever that is constant. It lasts about two to 4 days, and it's a fever that comes and goes.
Yes.
So it's a fever that comes really, really high, and then there's a break period, and you're not as feverish, and then it comes again.
Yes, so that's what we, physicians call waxing and waning.
Exactly. So dengue fever has now there's a hemorrhagic component.
Yes. And what that does is that hemorrhagic means bleeding.
Right.
So you may experience some bleeding from the gums and, some rashes showing up on your skin. A lot of people, it looks like little pink dots all over your legs or your arms. Why is this happening is because, you have low platelets. And when you are, in fact, diagnosed for the first time with dengue fever, you come in with these fever symptoms, we would run the labs, you would send it off to see if you are, in fact, dengue titers positive. And when you are, in fact, dengue titers positive, what we like to, monitor on a regular basis are your platelet levels and your liver function.
Right, because your platelet is a component in blood that helps to do with clotting. It helps in clotting. So when your platelet levels drop low, then you end up having bleeding. So you get bleeding into your nose, bleeding into your mouth, your oral mucous membranes. So this is the thing that is very, very dangerous and detrimental to patients. Now, dengue fever, unfortunately, has no cure, and there aren't any medications that we can give that can combat it immediately. It is only supportive care.
Yeah, so many people, when you tell them that, they don't know how to exactly feel about it. But, you have to remember, it's a virus, and most viruses have a beginning and an end point. And there's nothing to do in between there besides offer good supportive treatment.
Right, and good supportive treatment, there remain fluids, a lot of bed rest. I mean, there are patients who've been diagnosed with dengue, and if you're out and about and you can still tolerate food and you can still tolerate drinks, then we will send you home. It's only if you're really, really bedbound will you be admitted to hospital. So if you have been diagnosed with dengue, and the doctors have sent you home, it's because there isn't any specific magic pill that they can give you to make you feel better. You just have to really, really just start getting better by staying home, getting bed rest, and lots of fluids.
And then we'll just continue to monitor your liver function and then continue to monitor your platelet levels to make sure that it doesn't drop, and if it does drop, that you're not having any excessive bleeding.
We've been talking about dengue fever, but now we're going to talk about something that's very, very similar because it's spread by a mosquito, by the same exact mosquito.
The Aedes aegypti mosquito.
Right, and it's called chikungunya virus. Now, chikungunya virus.
We've probably heard a lot about the chikungunya virus because it is now prominent all over the Caribbean. It's popping up more and more cases of it. It's even spread to the US now. So, we probably want to know exactly what are the symptoms of the chikungunya virus to look for.
Now, chikungunya virus is very, very similar to dengue virus and Ebola in terms of their presentation. They all present with a similar viral prodrome.
Fever.
I mean, when you have a viral illness, even all the viral illnesses, the common cold, the flu, all of them have a very, very similar presentation, which is headache, fever, you might have diarrhea, vomiting, rash, joint pain, and but the difference between the chikungunya virus that's separated from the dengue fever is that the fever is very high
and the joint pain
and constant. It's a constant fever. It does not come and go. The other thing that really, really sets it apart is that joint pain. The joint pain from chikungunya virus can be very, very debilitating. Even when you have full recovery, you can have that joint pain lasting on for a very, very long time. So one of the biggest obstacles in patients trying to recover from chikungunya is having to face that joint pain. That is the problem with the chikungunya virus, that joint pain. So also, like dengue fever, there is also no treatment. There's no treatment, there's no cure.
And the recommendation would be to drink a lot of fluids and to get a lot of rest with the chikungunya virus as well.
Right, so it's a similar type of supportive treatment for dengue and chikungunya virus.
Right. We're going to take a break now, but when we come back, we'll continue talking about the chikungunya virus. And we're going to give some helpful tips on how to avoid or to lower your risk of being bitten by these mosquitoes and contracting these viruses. So stay tuned.